My name's Julia Jones and I'm Professor of Public Involvement and Health at the University of Hertfordshire, and I'm the lead researcher for this public engagement project that's been based in the play centres in Stevenage.
My name is Chloe Carson and I'm a Senior Research Officer at Healthwatch Hertfordshire, and we were delighted to work with the university and the play centres on this project.
My name's Gemma Moret. I'm the Play and Wellbeing Development Officer for the south of Stevenage for Stevenage Borough Council, and I'm based at Banley Hill Playcentre.
My name is Elspeth Methy and I work at the University of Hertfordshire. I also have a role with the ARC East of England, which is the Applied Research Collaboration.
We do a lot of involvement in our teaching and learning activities and research with members of the public from Hertfordshire. But we were very aware that we were always inviting people to come to us, to the university. We weren't going out to the community. So there were two main aims for this piece of work. First of all, we really wanted to engage and listen to children and their families living in Stevenage.
We wanted to try to include the voices of different groups of people who aren't often involved in research. So here in Stevenage, it's been families and children, so using creative play methods.
We wanted to learn about the children and their families, about what their health and wellbeing priorities are and what concerns they have and how we could learn from that.
The second aim was that we really wanted to build and further strengthen our partnerships and our research collaborations with all the different organisations.
We were also really keen to build a relationship and a partnership with both the Play Centre, Stevenage Borough Council and the University of Hertfordshire.
We were planning on doing that through holding focus groups with parents and carers, through activity sessions and focus groups with children and young people throughout the spring and into the early summer of 2020.
What were our shared expectations? What did we want from the project, and what did we want to learn from each other, because that was really important. From the university's perspective, we really wanted to learn from our community partners who collaborate, who work with the local communities, how best to engage with people, how best to open up conversations, particularly with children and young people. And the expertise was in the organisations like at the play centres and Stevenage Borough Council.
We looked at planning activity sessions and consultations with children and young people, and we started to look at planning the focus groups for parents and carers.
Something else that we did that I think was incredibly important at the start of the project is we had some joint training with an art psychotherapist from the University of Hertfordshire, and we had a training half day with research staff from the university, from Hertfordshire Healthwatch, and also with some staff from the play centres. Together we tried out some of the creative methods, the art activities together, and also how we were going to work together. And we had some great tips from the play centre staff about how to approach the children in the play centre, to let them come to us, to have a very open agenda and just listen to the young people. And that was, I think, incredibly helpful. So when we did start our engagement activities, we were all on the same page. We discussed how we were going to work together.
So we kicked off the project in February half term 2020. We'd planned a week of activities with the children that would be exploring different elements of health and wellbeing, and we based that at Banley Hill Playcentre for our initial part of the project.
We had a fantastic week of art and craft events with the young people. We came in 3 days, researchers from the university and from Healthwatch Hertfordshire, and we engaged in lots of different art activities.
Making art journals for the children to include their feelings and their thoughts. Also a graffiti board where the children had to write what made them happy and what made them sad and what they were good at. And also a box where the children had to talk about what they want to do in the future and what they want to be.
Working with Gemma, she really knew what the kids would do, so there had to be very short activities. They had to have something that would produce at the end that they could take home. And really it was just great. We could really be guided by the play centre staff who know the children the best.
I had a fantastic time spending a whole day playing with Play-Doh with the children. We asked them to just make whatever shapes they wanted to, but interestingly they started making food plates or making food and then talking about what they'd had for dinner the night before or food that they like to make, baking with their parents.
It was a real privilege to be able to just go in, sit down at the table, and the children, families and quite a few of the parents as well just wanted to come and do the activities with us. I think I was quite concerned before we might be sitting there on our own and the kids would completely ignore us. But actually they really wanted to come and just see what we were up to, have conversations with us, talk to us, tell us about their lives, their health, and it just naturally came out. And they were telling us about their health and what they'd done the night before, what they'd eaten. So lots of really interesting conversations without us having to ask formal questions.
And it really started to open up the conversations with the children about home life, family life, school, their friendships.
What has been really beneficial about this project is being able to work with the Stevenage Playcentre staff, Gemma, who knows the children. She knew the parents, she knew the family so well, and a number of the Playcentre staff we spoke to had known, I think, children, but not only grandchildren as well, that have been through this, so have known them for a long, long time. So we could really, really be led by them.
We had a really great week, and the purpose of the first week was to really try things out, to try out the different activities for the children to get to know us, being in the play centre with them. And then we had the next plan was that we'd do a similar event in the Easter holidays, and we were going to have an Easter tea party with the different families. It was all being planned, and then COVID happened. We were in national lockdown, and unfortunately we had to stop. The play centres closed. For the university staff, we all moved to working from home. So the actual face-to-face engagement, which was the main purpose of this public engagement project, just couldn't happen anymore.
Everything had to change. We were all at the university, had to stay at home. Gemma's job, obviously, she was redeployed, or the Stevenage Borough Councils were, other priorities. So we felt from our university point of view, we just really had to be led by what Gemma and the Place Centre staff obviously had such different priorities now.
We had to be flexible and think about what could we do. And what was brilliant was the Stevenage Play Centres were, when we did come out of the first lockdown, they were running activities in the parks in the summer holidays, and so we were able to fund from the projects and play activities and play equipment for the children. So we were still able to collaborate and support the activities of the play centres even if we couldn't be there in person.
We put a lot of thought into the activity packs to make sure that they were still encouraging development for the children, and we also put a lot of thought into the free gifts, etc., that we gave away for the same reasons. So there were things like frisbees, footballs, things that would get the children out and get them active and make sure that they were still able to look after themselves and look after their health and well-being through what was a really, really difficult time for them.
Then we hoped that maybe we could do the second round of activities in October, half term 2020. But again, it became clear that we were moving towards another lockdown. The play centres were closed. So we then funded some keeping in touch play packs and supported the play centre staff to hand those out to families during Christmas with a message from the University and Health Watch Hertfordshire and our other partners to say, remember that research work and the activities. We were hoping to do that again. Unfortunately, we couldn't, but we're still thinking about you and we hope that we can come back sometime in the future. From the first 3 months of the project and our collaborative working, we were able to really build some strong working relationships between the different partner organisations, and I think that has really sustained through the last year.
Although we've had to adapt and we haven't achieved as much as perhaps we'd hoped, there's been a lot of learning, and Gemma and Julia joined a national workshop where they talked about the research, about including voices which are not often included in research.
It was really important for us to make sure that we kept up communication with our partners, so we'd regularly email each other, phone and Zoom each other as well, and make sure that we were keeping that communication there, not just so that we could ensure that the project carried on to the best of our ability, but also for our own personal well-being. It's a very difficult time for everybody, and it really helped, I think, for us all to be able to continue to communicate with each other, share ideas, and just be there for one another. Obviously, due to the restrictions, we were unable to hold the focus groups and gather the information and the feedback from parents and children. So we devised a questionnaire that we sent out to the families that were involved in the initial activity sessions during February half term, and asked those families if they could complete that questionnaire around those activities and how they felt that the project had gone.
We are using remote methods now to do Zoom interviews or telephone interviews with different partners who've been involved in the project, so that we can learn, the key learning points from what has worked with the project, how would we do things differently, and particularly how we can all move together and collaborate in the future.
So for me, I think it's really important that we continue with the partnerships and the relationships that we've formed with other professionals over this project.
At Hertfordshire, we were delighted to build such a good relationship and partnership with the Playcentre, Stevenage Borough Council and the University of Hertfordshire.
We've all learnt so much from each other, and we've really developed some strong working partnerships, and we've learnt a lot from the Stevenage Borough Council and from the Playcentre staff about how to engage with local communities in the place where the communities are based, where the play centres are, and we've really got that strong foundation now for future working together.
Yeah, well, again, in my role with the ARC East of England, it's a 5-year project, so we've got another few years of working on. Although we haven't got any the project money has finished for funding, I hope we can continue with this relationship and move forward, developing further research projects and try and include the children and families in some of those priority setting exercises that we have.
It's been a real eye-opener to see how many people are so passionate about the health and the well-being of the children in our community, and I just really want to carry on being involved in that.
Going forward, we would love to build on that, and we would love to carry out some further research and engagement with them.
I think the partnerships that we have developed on the ground with the community organisations, with Stevenage Borough Council, who really know the communities that they work with and support. They're really embedded in the communities, and developing those partnerships I think is a very strong foundation for our future working together.